Parenting at any time can be challenging. Parenting during COVID-19 is even more stressful. Both you and your children may be feeling worried and overwhelmed. It can be hard to know how to talk to your child about this COVID-19, the whole situation, and how to best support your child as we all navigate disrupted routines and changes to home, school, and workplaces. And how to make sure you're taking care of yourself and your surroundings during this difficult time. Schools across the country have closed in response to the new coronaviruses. Many parents have questioned about how to go about their daily lives while managing their children, whose personal boundaries and hygiene levels are not always ideal. Helping children to make sense of the consequences of COVID-19 and helping them to organize their thoughts and feelings is the best approach. Today, our topic is parenting during COVID-19 and understanding your child through a very special art therapy. I'm Sanjida Haque, founder of Pratiddhani Foundation, and we have a very special person with us, Dr. Preeti Modi. She is child psychologist and art therapist from India. I'll give a little introduction about her. She has done her research in understanding child psychology through drawing, sketching, and painting. She has been practicing more than 10 years and conducted many seminars, workshops based on art therapy for teachers, parents, and also for corporate companies. She has n number of successful cases treated through art-based therapy and conducted in clinical setting. If you would like to ask any question, we can go through after the session. We can go and have a session, question session at the end of our session. So I think let's begin. Hello, Dr. Modi.
Hello,
Hi, can you hear me?
Sanjidaji.
Yes.
Yes, I
Hi.
can.
Okay, so I think we're all excited to actually, we really want to know. We have so many questions. I'm a parent, so I've been stressed also. So let's get
Yes,
started.
for sure.
So I'll ask you the first question. Okay,
Yes.
the COVID-19 has altered in lives of millions of people. In what ways COVID-19 affect the mental well-being and health of children?
Uh, it's very true that lockdown and COVID-19 has taken a toll over mental health issues and in a broader way. When I say like in a broader way, people were not taking much care of their mental health. They were literally dragged towards taking care of their physical health. But now, because of the lockdown and COVID, uh, the issues like the stress, pressure, anxiety, depression has
Yes.
people have gone through a lot of problems, and now they are not able to cope many a times because the routine has changed, right? And they have no much work to do. So
Mm,
another thing, like how to utilize their time, it's a bigger it's like a big question to them. So
mhm.
mental health is a question mark, and I'm glad that people are now taking care of their mental health nowadays, and they are thinking about it. They are dragging towards themselves to yoga and spirituality somewhere, and to keep their mental well-being at a pace.
So the children, what do you think? Like, how has this COVID thing has affected them in like,
Oh, yes.
uh,
So, speaking about children, kids, uh, they are going through a lot of anxiety.
mhm.
Uh, Another thing, they are not able to cope well with the family right now, because now I'm
Yes,
looking at
yes.
the many issues, like since I'm practicing during the lockdown as well. So the teenagers, they are not able to adjust in the home environment. The
Mhm.
differences of opinion has taken over, and the frustration has came over. So if I speak about from the adolescents to the teenagers and the younger one, some or the other way they are not able to adjust somewhere. There are many reasons, because they were active when the school was working, their co-curriculum activity was going on, the routine was set. Now
Mhm.
the entire thing has stopped.
And online,
So
everything is in online.
and is online. So
Yeah.
something like the physical activity is not happening, so they are restricting themselves. So when they are doing some activity at home, so even parents are not able to get themselves adjusting with the behavior at times. So it is going on both the ways. So parents are not able to work with the kids because they are also going through a lot of issues, and kids also they are going
Yeah,
through a lot of issues.
it's
So
it, it's a
whenever they
new
are,
thing. Yeah.
it's a new thing, exactly. So communication needs to be there. It's very much important. So like, if I speak more into it, it can go a long way, because it's very important to understand kids behavior and what they are trying to communicate
Mm-hmm.
with their behavior, with their
Exactly.
actions, and parent needs to understand that.
Yeah,
Yes.
yeah. I think we need to sit and talk, and because I think there's some question regarding that also. Okay, I'll go to the
Yes.
next question then.
Yes.
Reaction to the pandemic, including school closures, home office, and the closing of all non-essential shops, have
Right.
essentially put life as we know it on hold. We are just everything is on hold. We still
Exactly.
don't know when we're gonna get back to our next normal life. Which of
Yes.
these changes has a particular effect on children?
First thing, like not going out for their co-curricular activities, not going down for, like for playing with their friends. So social distancing has taken a toll over. They are not able to meet their friends. Kids, those who are
Yes.
very active, those it's like sports is the thing for them, and it works like a if I say, like, it's an energy to them when they are doing something. If that this thing has stopped somewhere, it has affected them very badly, because a few students, few kids, if I say, they cannot be at home and keep themselves busy, or like with some or the other activities. For them, physical activity is much more important. So
It's more
yes,
important.
yeah. So how to utilize their time, how to use their mind at a better way. So we need to figure out creative manner to keep them engaged with many activities, right?
Okay.
So if I say, like, now there have been kids where they used to go for art activities at some
Hmm.
classes. They were going
Karate
for,
classes.
yeah, creative classes and for handwriting classes. So this thing has
Yes.
been used to keep them engaged. Many kids, they just go and sit in the store, and they just have their own time. They read, they discuss, they have their brainstorming. There were a few classes, like, where five kids sit together and they do hands-on activities within
Hmm.
themselves. So everything has stopped. So but since the social media is there, everything has gone online. They are putting their effort to work at that level somewhere, but still they are not able to have that connection. They are communicating,
Connection.
but the bond is not seen. So that
No,
is
no,
again
it's not.
creating an issue. Yes. So that is
They're
again
being
another
pressurized.
difference.
Yeah,
Exactly. Be-
especially because constantly they're in this. They're having too much screen time. Schools,
yes.
everything is online, so they can't take that
Exactly.
pressure on screen time pressure.
Yeah. And additional problem, if I say that sitting in front of the laptop or a phone and in front of the screen for a longer period of time, that is also affecting them some or the other way.
Yes, yes, yes.
So that is again creating a mental,
Psychologically, so like physically
exactly,
they're sitting
psychological,
down. Yeah.
definitely. So that is again a new
Okay.
problem that is arising. Yes.
Okay.
So
Yes,
yeah,
my question. This is also. Yeah, I can go to the next question then.
yes, yes, please.
Because there's all next question is also like I want to know, like, should
Yes.
parents and caretakers tell their children about what is going on in what detail, like how much they should know?
Looking at the scenario, and where communication is the key, no matter with whomsoever you do, in my opinion, you should inform, or you should give a proper knowledge to your kids. It's very important. What is happening? What precautions needs to be taken? What is going in the city or the country? What is happening? You have to speak to your kids in a very layman term, in a very clear
Hmm.
manner, because the kids should know what is happening,
Yes,
and
yes.
proper information needs to be given to them, rather than haphazard information they are taking it from the internet or through their friends.
Yeah.
So it's
Through
very
through
important to
media
have a,
also. Yeah.
yes, so it's very important to have a clear communication. It's important that what is happening in the city, they are watching news, but parallelly, it's a responsibility of for parent that yes, this is the scenario. Everybody's scared and afraid of what is going in the country right
Mm-hmm.
now. It's a
Yes,
pandemic
yes.
issue, but we are also making an awareness to our kid that you need to take care of certain things which can save you from
Yeah.
certain situations.
Washing
So
hands and yeah.
yes. So, and we are also implementing it. We are taking good care, all taking all the precautions, precautionary measures, and everything. So the kids are going to follow the same. And if some vague information is coming from anywhere, so
Yes.
your child himself will correct another person. So this is what the current thing is. So, in my opinion, it is very important to have a clear communication, and it's equally important to tell them what is happening and what is the current
Mm-hmm.
scenario is, so they don't go just with the haywire information and tell their friends in a the same thing. So
Okay.
it has to be done, yes.
I mean, we should let them know actually from the beginning, like
Exactly.
what could be the consequences of it if you have it also.
Exactly, yes.
Okay. And okay, how can parents help their children understand and cope with COVID-19 and social distancing while managing their own complicated emotions? Like, I'm facing this thing. I mean, it's really hard for my kids to make them understand that you can't go out of the house and meet anybody else except whoever at home. So it's
Right.
impossible. So how
Right.
will we cope up with that?
See, you need to set a rule as we have done already. Whenever you want to stop your child from doing something, so you need to be, as I said, you have to have a clear communication with them. We need to speak about the consequences, as you also said that we have to make that clear also, that what is the consequences
Hmm.
you will be facing. Another thing, if you say it in a different manner, like the social distancing needs to be maintained, so we can have an online session with your friends or whatsoever they want to go with, and
Hmm.
engaging them with the creative activities, or if you are working, if you are a working woman, so you need to speak about the rewards rather than threatening them that if you are going to do this,
Mm.
so the screen
Yeah,
time
yeah.
will be disconnected, or you will be punished for this or like that. So rather than, you should thank him that I would appreciate if you can give me 10 minutes or 15 minutes of time. I need to finish this work, and then we will catch up with this something. So if it is experimented though, if you tell your
Yes.
kid that you are busy for half an hour, so if you are busy for half an hour, you are giving a task to your kid for an half an hour, so your child will also engage in some other work. He will allow you to do your work, and after
Mm.
half an hour you can give time to your kid, so your work is
To
done,
our kids.
your kid is also engaged with
And
some other task, and then you can
yes,
utilize the time with your kid, and rather than most important, you thank your kid that you allowed, that you did not disturb me. So
yes, yes.
focusing on the motivational word, or positive word with your kid when you're talking to him, or you're encouraging your child, so positive word needs to be used rather than
Hmm.
threatening. So generally what we do is, no, if you will not listen to me, I will not allow you to go down. If you're not
Okay.
listen to me, if you're not complete this task, I will not let you do this, right?
Hmm.
So during this pandemic issue, it's very important that you prepare a schedule for yourself, including your kid. What are the important activities needs to be done? When you have your work, you need to time limit it, because you need to give time to your kids also. And
Hmm.
when you be with your kid and doing many activities, like reading a book or doing some
Yes.
creative work, so your child will also enjoy your company, and they will not ask for
Mm.
the third person. So
I
yes,
know.
even if they are asking you to, I want to move down for half an hour, so let them go, because it's again important that they take the decisions on their own. Definitely it's our responsibility to tell them what are the repercussions and what can be the consequences are, and if they feel right that still they can go down with the taking all the precautionary measures, then set a time limit for them. So you
And they
have to
can
go
have a
for half.
online session with their like online session. What do you call it? Like a video chat with their friends also, because they
Yes,
really miss school and they miss
they
everything
do,
about school.
they
Yeah.
do, they
I
do.
think that's
So
really affecting them. And also the
it is
sleeping
indeed.
pattern has changed.
Yes, it has. It has. So, because of this lockdown, many things has changed. The diet has changed. The sleeping pattern has changed. The thought process has changed. The perception has changed. The increase of anxiety, depression, frustration, denial, and phobias have increased a lot. But
Mm-hmm.
as we are saying that we need to go with this with this life only. So looking at the current situation also, we need to prepare our kids for the worst also. So if that's why I'm
Okay.
mentioning, if
Yes.
your kids are more pressurizing you that I want to go and play down, right, I want to go and meet my friends, then you need to make them sure that these are the precautionary measures you need to take, and for this time
Mm.
limit, not more than that, and it has to be under
Yes.
our observation. So the
Yes.
kids
Yes.
are also trying to take the responsibility of their own. You are allowing them to take the decision, and in future if they are coming with some queries in front of you, so you are giving them an option. The decision has to be theirs, but you need to support them. What are the things, the pros and cons basically. So it's
Mm-hmm.
our responsibility to show them what are the pros and cons, and then let them take the decision, because ultimately in future they have to take the decisions of many things. So you are a support
I
system to
know.
them.
I know.
Yes.
Yes. Okay. The next question is, what are some simple tools families can use to improve communication during this transition?
Oh
I
well.
think you, yeah.
See,
I mean, to your
communication.
context. Yeah.
Yes, so communication is definitely very important because of this pandemic issue, and it's very important, to understand the emotions of a family member at this particular scenario as well. So yes, when you are talking to your kids, first thing needs to be very clear. The communication has to be very clear. What are your expectations and what your child is expecting from you? You need to understand. Second thing, uh, you have to pay attention to what your child is trying to say. Many a
Hmm.
times kids are using non-verbal things to non-verbal communication they are doing many a times. So
Yeah.
uh, you need to pay attention to it when they are speaking. And generally what happens is, because of the lockdown, many kids and an individual or a parent, they have engrossed themselves over a mobile phone. They keep on scrolling up and down to the phones.
I
It's not
know.
that they are, yeah. So it's important that when a kid is sitting with you, or your families are sitting with each other, when you are having a quality time or when you are having your meal together, make sure no gadgets are there. You share your emotions. What are your feelings? What new things you want to do today? What are the new creative work you want to work upon? And if you ask your kids, like, kids have the beautiful imagination and perception
Mm-hmm.
they carry more than
I
what
know.
we have. So if you
I know.
ask
I
them
know.
that yeah, so if you ask them what new you would like to do today, they will come up with better ideas than what we have. So definitely, communication is the key, but it's more important how, you need to pay attention to the words that they are speaking to. You need to understand what emotions they are expressing, because it's like, uh, kids don't speak that well about their emotions. They
Really?
express.
Oh.
Yes, they express us with different manner, different ways. But if
Oh,
they
yes.
say,
Yes.
if words
That's
are
true.
not words are limited to
Yeah.
them,
Yeah. Yeah.
right?
Words are limited. Yeah. At
Words are
every
limited.
ages, I think. Yeah.
Exactly. So words are limited to them. So because of this pandemic, many cases where I've seen that parents are not able to cope well with their emotions also, because they are also worried somewhere, and
Yeah.
that energy is also affecting in the family. So
Mm-hmm.
yes, this situation has arisen in the whole country, but somewhere we need to fight with that. And keeping our mental health well-being at pace, we have to divert our mind somewhere. And yes, speaking with your co-workers, what is going on, what new things you can work upon with your hobbies or passion. So we can do something like that also. So
Mm-hmm.
this can help you to focus on some new activities, that you are always looking for some passion and you want to work upon when time was not there because of the work
I
and
know, I
other
know.
responsibility. So keeping that thing into one hand and sharing more things about your new things that you're experiencing with families, that can bring definitely a positive change in the family.
Family, yeah, that's true. Okay,
Yes.
and the next question is, okay, how can parents work with their kids to set healthy boundaries right now? Like
Oh
you said
well.
earlier, yeah.
Hmm. Yes. So as I said, like
I mean, we can't dictate right now. This is not a time for like we can't dictate right now. I don't think so. We have to
no,
make them
no, no.
understand. Yeah,
We have to
yeah.
make them understand, and to make them understand, we need to execute it. We need to implement it on ourselves first. That
Yes,
is the
that
one
is
thing that
true
you
because
can
they
do.
follow. Kids always follow. Yes,
Exactly. So
yeah.
if you are changing your eating pattern, your diet, your appetite, if you are changing with that, your kid is going to follow you or follow the same thing automatically, right? So yes, if we are executing everything, they are going to observe you, and they are trust me, they are keen observer. They
Now that's
observe
very
each
true
and
because
everything.
uh, because Dr. Preeti, I have a 10 years old kid. Yeah, that's okay. He's always watching the news and all. I have a 3 years
Yes.
old son also, little boy.
Okay.
I was
All
really
right.
surprised that day. We just went out for a walk. He came down. He's like, "Where is my mask?" So he saw
Okay.
everyone wearing it. So that is
Yes.
how, this is like awareness is building that way. He sees
Exactly.
everywhere around him. Everyone is wearing mask and washing
Yes.
hands, using sanitizer. So he was worried
Yeah.
that he needs to wear a mask also. So I think
So
that's
that's
how
what
they learn.
that's how they learn. And see, if you want to teach your kids, we have to be the idol for them, right?
Yes,
Since
yes,
like
yeah, that
by
is
the
true.
time they are following us, once they are going to go in an outer world, they are going to have their own peer group, and they are going to have their own
Hmm.
decisions where they have to take. So this will now the stage, this will help them to grow in future. So what is right,
Okay,
what is
okay.
wrong, what is right, what is wrong, that is a secondary thing. But if my parents are doing this and
Hmm.
they are giving me a chance to share my thoughts and ideas in front of me, then it's good. So if even if they are discussing anything outside, like teenagers, they will definitely come to you, and they will discuss with you.
Hmm.
So yes, rightly
Okay.
said. We need to execute it first. What we are doing, how we are taking care of ourselves when, during this issue, taking all the precautionary measures and health measures. The kids are going to follow you automatically. So
Yeah,
that's the thing. Yeah.
that's how. Okay, so will my child be behind in their social skills due to social distancing? Like, I think, I don't know, maybe how will they cope up when the school reopens? You think
See,
it will affect?
somewhere it is going to affect, not because what happens is kids are scared, but many kids,
Yeah.
like they have their they go with their instinct, right? So
Hmm.
if they are going to meet their friends, definitely if we beforehand, before sending them to the school, we ask them to take some precautionary measures, they will be taken care of. But yeah, the things that they used to share before the pandemic issues, now things
Yeah.
are going to change. They That is going
Change.
to change, and somewhere it is going to affect it also, because the school environment is going to change, and things have to be managed in a different manner.
I know. I know.
So yeah, so
It
social
will be.
distancing,
It will have an effect. I think it will definitely.
it will,
Like,
it will definitely.
what will they talk about? I mean, I don't know. Let's see. This is new, and that is also new. What's the after effect of COVID?
Exactly.
Yeah.
Yes. So yeah,
Okay.
so the sharing will happen in a different manner. Few
Hmm.
experiences that they have seen in their family, or they have listened from their friends. So it is going to happen. The sharing will be happening. What
It's
they
going to
come up.
happen with us also. So, I
Yes,
mean, children definitely. Yeah, it's going to affect us also.
exactly.
Yeah.
Yes, yes, definitely. So they are the kids.
Oh, yeah. Okay. So my next question is, how can parents cope with potential exposure to COVID-19 while still being present for their family? Like,
Okay.
there are some parents, so how can they, like,
Uh,
they have to take care of the family, plus they go out every day. And I think, yeah.
It is a difficult, actually, it is very
And they
difficult
can't be
for
out of the house. Yeah.
yeah, it is very difficult for such parents because if I say like the practicing doctors, they have to go on a daily basis to the clinic and to the hospitals by wearing PPE kit and everything, right?
Hmm.
So it has affected them somewhere because not being for their family, they are also their mental health is also affecting somewhere. It's just that
Hmm.
that focus is to taking care of the patient at that particular moment. They are not expressing, but they are also broken
Hmm.
in somewhere. So it is difficult for a working parent, those who are like doctors or so the practicing psychologist or psychiatrist. It is very difficult for them, but somewhere I believe that when they come home and with the respect that they are getting, with all the things that they are doing for the society, it's remarkable.
Hmm.
But yes,
Yeah.
it's important that family support is needed because without a parent, a child is also affecting his mental health, is also affecting the child, is being away from the parent at that particular moment, and that has also increased a lot of issues with the child. So
Okay.
yeah, so
It's
it is
difficult for
difficult.
them.
It's difficult, exactly, it's
It's
difficult.
really difficult for
But
them.
we need to assure, we have to make our family assure that we are taking good care of ourselves and all the precautionary measures, but still family is
Hmm.
going to be scared of what is happening outside the world. So
I know. I know.
it is scary, but yes, we are
There's
fighters.
nothing else we can do. Just taking, yeah, just to take precaution. Good precaution will always help.
Exactly, exactly.
And yeah, how can I help reduce my children's anxiety and worry about COVID? But sometimes they get worried, like media. So many people are dying all over the world, like India, Bangladesh. These countries are really affected.
Yeah,
We have more
exactly.
increased number of
Right.
COVID cases, and the news are everywhere. You can't stop them watching the news or something.
Very true.
So they're really stressed.
So the best way, if I speak about how to work with their anxiety and if they are having any emotional problems or emotional disturbance, if I speak about a therapy, that is art therapy.
Yes.
So art therapy is something which allows an individual to express his emotions on a paper,
Mm-hmm.
either with colors or any art material. So,
Okay.
looking into it, any creative manner and any creative form, either if listening to the music or dancing form or doing sculpture or doing painting or scribbling, doodling, anything. So that will help your child to throw out the emotions and fear, anger, whatever that the child is going through for a particular moment. He will be able to release all his fear over a paper, and that can give him relaxation. It
Okay.
is very
Okay.
important because many a times when we talk about teenagers or adolescents, they suppress their feelings, and because of the suppression, many issues going through, they go through. Talking about mental illness,
Mm-hmm.
so this is one of the best medium to put out their emotions on paper and to realize what they are going through. And it is again when we interpret the drawing, because you need to have an expert help to understand what is the child is going
Mm-hmm.
through or what is
Exactly.
individual is going through. But if you have no such people available at that particular moment, but definitely release of the emotions through this medium, that is going to help. Another thing that what you can do is engage your child in different form of activities. If your child is likes to do cooking, if he has some cooking skills, then we can help our child to work divert their mind over there. So with the support of
Mm-hmm.
with the guardian or a parent, they can be there and help the child that let's we need to motivate them first thing. So
Yes.
any
Yes.
skills, any skills that your child has, because of the COVID and lockdown and the anxiety, depression, frustration, fear has increased at a very high level. So
Yes. Yes.
so it has created a lot of problem, mental health problem among the kids and the parents.
Mm.
So engaging your kids in this way, this can help
Mm-hmm.
to release their emotions in a better way. So we
Better way.
can try
Yes.
this. Yes, so you can
Yeah.
try
I'm.
this
I'm going
therapy.
to. Yeah, I
Yes.
want you to actually explain this therapy after my question session because
Okay.
I want everyone to know this unique therapy.
For
Like I
sure, for
myself
sure.
want to know about this. Okay,
Okay.
so I'll just go to yeah, we work with children who have often lost parental care or grown up in alternative care. Some of them
Right.
have experienced trauma. Is there a
Right.
risk that COVID-19 can worsen their mental state, specifically perhaps sparking previous trauma? Like there are some kids,
Yes, it will affect
you
to
think,
some level. Yes, I think
okay,
because they are already gone through a lot of past and like the traumas in the past,
yeah,
and at this moment when they have no one with them who can understand them better,
hmm,
again what I said, the feelings and emotions they are suppressing, they are not letting it out, right?
hmm,
The love and affection, the care they are looking for, if it is not available at that moment, it is going to affect them some or the other way. So
okay,
yes, so speaking about it, if uh, such kids are being helped with some, the experts who can go and talk to them and help them how to take care of them, a little love and little affection showing
I know,
towards them, so that can definitely work for them because they also need an attention. Some
yes, 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 that is
so
true.
that can help such kids to overcome such emotions, because what they are going through nobody knows. It's just what we just assume, or we just can hypothetically can understand that what can they must be going through, but it can be a lot more. Nobody is there. So yeah, so
I
little
know, this
help,
is true.
an expert can go and take care of them for a while and just talk to them, understand them, listen them. They just need somebody who can
Hmm.
listen to them, so that can work for them.
Okay, my last question for the session, I'm going to talk about the art theory. I'll ask you some question on
Yeah.
the art theory. I mean, when we talk about child, we can't forget the autistic, like special needs child also. So
Yes.
schools and their schools are also closed, So how to help these autistic
Yes.
children, cope with this pandemic lockdowns? They're at home. They just got back to their parents. Their parents are stressed, and their behavior. I won't label. I will never label a child autistic. I think all childs are special. So when we call a
Exactly.
special child, I think we're the one who label the child. Their child. I
Exactly.
think we
Exactly.
shouldn't see someone as a different way. From as I mean, to my perspective, I don't see any autistic child in a different way. They are child. They all child are
Gotcha.
always special. Some are different. So you can talk a
Exactly.
little bit about the autistic child. How will the parents? I mean, how can I mean
Um,
the activities will be totally different.
exactly. So initially, when the lockdown was there, we have done a webinar for special kids. Actually, speaking about that for
Okay,
all the
okay.
parents, how to take care of the kids during the lockdown. So.
Mm-hmm.
Because such kids needs little more attention than the kids that we have, right? So
Mm-hmm.
to make it little easier for the parents, we have few activities for the kids that can help them, because when we speak about autistic or down syndrome, their needs are
Mm-hmm.
little different, right?
Right.
So they need to have sensory integration therapy, they need an occupational
Yes, yes.
therapy, right?
I know.
And they need to go with the routines. Actually, the child cannot bear with the changes in their routine, so it can also
No, no.
again affect their behavior. So
Mm-hmm.
what a parent can do is the same therapy they can execute at home. How?
Okay.
Setting the rules for the kids, keeping a track record of the kids, like if the child is taking before the lockdown when the therapy was going on a routine manner, so if the
Mm-hmm.
child was taking that 10 minutes to complete the task, so again they need to work upon the same task, setting one simple goal for a kid. So if the kid has started brushing the teeth on his own self, so now when the goal that goal has been cleared, then they need to set with another goal, like the
Yeah, I
buttoning
think
the shirt
making them
or whatsoever.
independent. Yes, yes, yes. Just
Exactly.
make sure that
And
they do your own work.
exactly. And top of it, when we talk about sensory integration therapy, simple tools that we have at home, like the brushes or something, you can use it, and you can scrub in their palms or foot where they can give such therapy by sitting at home, which is
Okay.
that can give the acupressure in their hands, or like that, the scrub thing or like that. Okay. So it can help a parent to ease the the therapy is not stopped, but they are able to give such needs that the child is in need of.
I
The
know,
needs
I
are
know.
being fulfilled.
So that they
So
don't like, yeah, like
then
so that they're attached to their what they do at school also, so they
yes,
can do the
so
same practicing at home.
exactly. So what with the limited tools they can do, the charts we what during our webinar what we have showed that we have showed few charts to the parent how they can keep a track with the things like the how to make the kids independent by when the child goes to the that chart, it's an auto visual thing. So the child
Hmm.
will go himself and see that okay, I've done this, I've done this, I've done this, this is remaining. So
Hmm.
on a simple way you can teach your child. You can also, the learning has not stopped, the academics what they were doing, keep continue with that. So the therapy is going on. The diet needs to be taken care of. Whatever the diet was recommended by the experts. And yes, online sessions. Please go with it. And for many
You think
kids,
they need to, okay, I have one question. You think
yes.
they need to know about this COVID-19? Like they might ask question, why are we at home?
Uh,
Why can't we go to school?
So, for high functioning kids, yes, you can explain it to them what is the scenario. But when you are working with a low functioning autistic kids or Down syndrome,
That's
it
different.
is
Yeah.
that's different for them.
They,
So, yeah, if you
yes,
have
yes,
high
that's
functioning
true.
autistic or Down syndrome, definitely you can explain it to them and they will understand better. So they will follow all the
I
precautionary
think
measures
there's
and everything.
too many questions on this issue. I think I need to do
Exactly.
one more session with you with
No
this.
worries.
Okay.
Anytime.
So
Anytime.
let's talk about the our next segment, which is understanding child through art
Exactly.
therapy. What it is actually? What is
See,
exactly art therapy, and what do you mean by that? So
Speaking about art therapy, it's like, it's a therapeutic tool, basically. We have understood about the aptitude test, right? Then we know about cognitive behavior therapy. We know about REBT therapy, rational emotive behavior therapy. Art therapy is something little different from it because when I speak about art therapy, it is a free association
hmm,
test which I do with an individual. My research was
okay.
with kids. So if I ask a child
Hmm.
to draw, all right, so after the drawing, I interpret the drawing, and on the basis of that, I do the counseling of a child and a parent. Now, why
Okay.
child? Basically, as I said earlier, the child has a limited words to express their feelings and emotions.
Mm-hmm.
So there is a lot of things that's happening in their subconscious mind. If the home environment is a little problematic, if like something is going wrong in the home or something is going wrong in the school and he's not able to cope well, so maybe he's not able to express with words, and even when parents ask, he's not able to speak the
I
emotions
know.
or the fear that is. So whatever is there in the subconscious mind,
They can
they
draw.
they draw, and I interpret it, and then on the basis of that I do
Okay.
the counseling for the parents, because it is important that parents should know what the problem is with the child. It's not that that child doesn't know what he or she is doing. Why there is a change in the behavior of a child, there is a reason,
Okay. Okay.
right?
Okay.
So the child doesn't change the behavior all of a sudden. There is
So
a
if there is
reason.
a, yeah, if there is a change in their behavior, then they can go through the art therapy. Otherwise, art therapy is,
Art therapy,
I have,
see, there is no particular reason to go for art therapy. Art therapy, if I do it with you, for example, so
hmm,
with you also I can do a therapy session of art, right?
okay.
So
Okay.
if I want to know about you, so it will also give me a little glitch about your personality, your nature,
Okay. Okay.
and there is
Yes.
always process is different when I work with a kid and then when I work with an adult. Okay,
Mm-hmm.
so if I'm working with an adult, there is the process and methodology is different. So if I want to know the current state of your mind, that is there any
Yeah.
problem that you are going through but you're not speaking up, so your drawing is definitely going to reveal that problem to me, that what is the current
Yeah.
state
Yeah.
of
Yeah. That's
mind
true.
that you are going through. And if I interpret that drawing, and on the basis of that I can do the sessions with you, and then after the sessions that
Okay.
I'm asking you to draw again, then the changes in the drawing you will be seeing. So when the session starts
Okay.
and when the session ends, you can see the changes in the drawing as well.
So, oh,
So
so how many session it could be? Depends on the individual.
it depends on the individual. It depends on the problem that an individual is going through. Because when
Okay.
I do art therapy, the parallelly the counseling is also going on for the child and for the family also, because
Okay,
it is
okay.
always a teamwork, right? Not only
Yeah,
that,
yeah, yeah.
even we it works for the couple therapy also. For couple also, we conduct this art
Okay.
therapy to understand their each other's,
Very
where they.
interesting.
Yes,
Yeah.
so it also helps to understand the the couple. uh, Art therapy is also used for any particular disease. If I say anxiety hai, depression, or Parkinson's,
Mm-hmm.
if I have worked with a cancer patient, speaking about art therapy, I have done an art therapy with a cancer patient. The result were like the patient came out of that trauma, that the scenario, the negativity that the patient was in, and through the drawing and through consecutively, when the patient was doing, the patient turned out to be positive, and she fulfilled her dreams by writing a book.
Okay. Wow.
So
Very
this,
nice. So
yes,
nice.
so art therapy helps you to reveal all the emotions that you have.
That
It
insight, yeah.
Yeah, so it does not only work with the kids, but it also works. It's a
All
sky's the limit,
levels.
all levels, even
What
for the
about the
corporate
corporate?
company.
Yeah,
Yes.
my next question was the corporate, yeah.
Yeah, so when you work with the corporate, that helps to strengthen the bond between the team first. The unity level that increases with the corporate.
Mm-hmm.
Third, they are able to release their stress that they are going through, right? So
Okay.
it also works as a distressing themselves, right?
Mm-hmm.
uh, Fourth thing that helps them to have an open, the horizon is open, the new ideas and the new perception they can have, new imagination they can think about. So it works at a very
Mm-hmm.
different level. So as I said, when I work with kids, the process and methodology is different. When I work with a corporate company, the
It's
process is
different.
different. When I have this group art therapy session for the teachers, the process is
It's
different.
different.
So that gives me a
You
lot
can
of
see the
ideas.
difference. I mean, you can see the difference when a patient comes at the beginning and at the end of the session. You can see the difference, right?
Exactly.
Okay.
So it is seen
There's a
very
positive,
evidently.
positive difference. Yeah. So
Yeah,
in the
so if
meantime, when they go through art therapy, I have one question. Sorry to interrupt. You know,
it's
when they're
it's okay.
in the middle of the art session, like art therapy, do you do any other counseling to the patient, like, or only art therapy?
No, it's only art therapy. It's only
Okay, okay, okay.
because it's
No medication,
important.
nothing.
No, nothing. Because what
Okay.
happens is when art therapy is going on, as I said, we once the paper I get of the child of working with the creative thing that he gives me, after the interpretation of the drawing, the counseling goes on for the child and the
Mm-hmm.
parent, because it's important to go to the root cause of the problem. It's just not that.
Okay.
Right, because unless and until you don't
Yeah, yeah,
find the root cause, like whether the
yeah, yeah.
child is behaving, there are many reasons why child behaves for vaguely or weird. There are many reasons, so we need to understand it, why it is happening,
Okay.
why parents are not able to understand their child many at times, because the parents also they have many other issues, because work pressure, home pressure, other responsibilities. They are also exhausted. They many times they
Yeah,
are not
yeah, yeah.
able to pay attention to their kids. So there are n numbers of reasons. So when you find the right cause of it, when you speak to the parent about it, and when the sessions are taken care of, the changes are done in the family, in the home environment, the results are positive after the sessions are taken with it. So there are hundred
Oh,
and 1,000% chances that you see the changes in the child also.
wow, that's very nice. I mean,
Yeah,
it's really interesting. I have one question.
exactly.
Like, I don't know about the art therapy. Is it a piece of blank paper you give them to
Hello.
tell them, right? Or you can show me. Hello? Can you hear me? Hello?
Hello.
Hello, yes. Can you hear me now?
Yes, 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 I
Yeah,
can hear
okay.
you. Yes,
Sorry.
that's okay.
Sorry.
Yeah.
Okay, so since I don't know about the art therapy, so is it a piece of paper that you give them and they do some colorings, or can you show us something? Uh,
Sure. I'll show you one drawing. Uh, okay. This is a drawing,
okay.
right? If you can see,
Yes, yes.
yes. Now, this
Yeah,
is a
I
drawing
just,
of a
yes.
5-year-old, 5.5-year-old kid. Okay.
Okay, okay. Yes.
So, if I
So,
speak about a little gist about the problem that was going through,
hmm.
you can see the scribbling part, right?
Okay,
Right?
let me just show the, yes, yes, I can see
Right?
that.
So,
Hmm.
this child is
It's in
ADHD.
black.
Yeah, so it's
Okay,
black, but you can see
okay.
the entire picture, how haphazardly he has done. This child is
Oh,
hyperactive. Okay.
hyperactive. Okay.
So he's an attention deficit hyperactive disorder. The child was having. So after the sessions and everything went well, now the
Hmm.
changes that you can see, let me show you one more. See the changes in the drawing.
Okay, he knows how to put it in, like all the colors are in one
Perfectly
box and
done.
it's not scattered around.
It's not
Yes,
scattered.
it's perfect
So
done.
even the colors were gone, like, in this horizontal manner. It's not done just like that. He has maintained the line.
Wow. After how
He
many
has,
sessions? Like,
it took me 2.5 months to 3 months,
okay.
right? And this
Wow.
is a
Wow.
mid work which I have shown you,
Okay, okay,
right? So the
okay,
changes you can see already. So art
okay.
therapy, when I speak about art therapy, it doesn't only help the child at one particular way, but also strengthen the motor skills also, right?
Mm-hmm.
So if you can see here, it is done just like that, right? This
Mm-hmm.
Okay. Now the
Yes,
same
yes.
thing if you see here,
He knows more, like how to put
he
the
has
color in one
exactly,
box and how
and
to
over
mix
here,
up colors and
yeah. So you can see the changes,
yes, yes.
right? So the
Wow, very
patience has
nice.
increased. The patient level was he was able to wait for his time, and the
Yes.
patients were boosting, and uh, he was less restless. He was restless, definitely, but he was less restless. It was task oriented, time oriented. So slowly and gradually,
Mm.
we can set the timing for the kids, and the child can definitely give you this result. Another drawing, if I show you now, this is a drawing
Mm.
of a 12-year-old kid,
Okay. Wow.
right? So
Yes.
now, like, if I say this child is and he's having anxiety, high level of anxiety, right?
Really? But the
Yeah,
drawing is perfectly done?
perfectly done. But
Yeah.
because it's not that clear to you, the thing is, when I asked him to draw, okay,
Mm-hmm.
the
Mm.
the anxiety level was shown in this drawing also, because he has
Okay.
done this drawing haphazardly. He did not do it with a peace of mind. He was anxious and he did this drawing.
Okay.
So,
Okay. Okay. Now I get
right?
it. Yes.
Yeah.
Yeah.
So, this also shows me a lot of understanding about the child, at what level the child is. So,
Okay.
after still the session is going on. So, once the child is able to handle himself at an anxiety
Mm-hmm.
level, if he's able to cope well with it, the changes will
Mm.
be seen in the drawing. So,
I want to
uh,
see that child's drawing once the session is over, actually. I'm
definitely,
sure
definitely.
he'll be a very good artist.
Exactly, he will be. He's highly intelligent kid. If
Yeah.
he's very intelligent, if I say, but it's just
Okay.
because of the anxiety level, because of the pandemic issue. As I said, anxiety has increased in many at a very peak level with kids.
Yes, 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 that's
So
true.
this is a sign of it.
Okay.
It's like
So
that.
you give them a piece of paper and you tell them to do whatever, or you instruct them, just do
No,
this.
I ask them to
Okay.
do whatever they want first thing. So it
Okay,
always starts
okay.
with that, because it's very
Okay.
important to give them the space, that space,
Yes.
what they want to show up. There is a time later on after when I instruct them what they need to draw, but it's always start with whatever they want to show up, because that gives me a little more.
That's how you,
I
yeah, scenario
that
of
gives
the patient
exactly,
actually. Yeah.
exactly.
Okay.
Yes,
It was very interesting, and I think we're almost like it's like 8:49. And
right.
thank you so much. Thank you so much. It's really, I mean, I'm sure the viewers are also very happy. We
Thank
got, I
you.
mean, and they really, I mean, I could see some comments, it's very interesting and they really enjoyed. And if there's question, then I will inbox you definitely. So since we're
For
running
sure.
out of
Anytime.
time, I just want to thank you so
Thank
much
you
for your
so
valuable
much.
time. I mean, all the
Thank
way
you.
from India, you give us
Oh,
amazing time, and of course, a really unique art therapy. I got to know, and the viewers got to know about it. And I'm sure,
thank
I mean,
you.
I want to tell all the viewers that we will work with the art therapy from our foundation more. If you
Sure.
like to know more about the art therapy, you can contact me, and I will contact Dr. Modi about this art therapy, unique art therapy. So,
Right.
anything you want to, I mean, talk about this session? Like, how was it? This is your first session
Oh,
with Bangladesh, right?
yeah, first session with Bangladesh, and I'm really honored. And thank you so much for approaching me. And it was like to speak about my work and bringing an awareness to the country like Bangladesh while getting associated with that. It's an immense pleasure to me. So thank you so much for having me here and speaking about my work and bringing an awareness about mental health, well-being, how
Thank
important it
you.
is.
Thank you
Thank
so
you so
much.
much,
Yes.
Sanjidaji. It's an honor to be
Okay.
with you.
Yes, it's an honor for me also. Like, you really agreed. We don't know each other, but this is the first time we met. And when I approached you, you right away wrote me an email and you agreed to that. That's a very kind to you. I mean, I'm really
But
thankful to you.
thank you so
Okay,
much.
so
Thank you so much.
I'll end the session with a little note from me. See, nowadays, dealing with quarantine is particularly very stressful experience for parents who must balance personal life, work, home, and their children, and raising their children, being left at home without other resources. This situation put parents at higher risk of experiencing distress, potentially impairing their ability to be supportive caregivers. The lack of support these children receive with such difficult moment may be the reason for their more pronounced psychological symptoms. Policies should take into consideration. I mean, I don't know whether I don't know whether India, is there any, are they implementing any policies regarding the, like, child mental health or anything like that?
Yes, yes, yes. They are. They are. There are
Okay.
policies like that. Yes.
Okay, so I think
Yes.
we should, like I have done this program. I think there will be more organization coming up with this kind of issue regarding the child psychological behavior at this time. And
Right.
I mean, they should come, and the supportive intervention for the immediate and for the future should be promoted. Uh, me, Sanjida Haque, and Dr. Preeti Modi, thank you once again. And
Thank you, Sanjita ji.
I would like to tell all the viewers who was watching our show, thank you once again, and thank you for watching us. And you wait for the next session. You will get to know. And please like our page to get more updates about Pratiddhani Foundation. And
Yes.
thank you all.
Thank you.
Thank you to
Thank
you
you
also.
all. Thank you.
Okay.
Yes.
Bye.
Bye. Thank you.